Throughout Canada, significant gaps exist in access to healthcare in prison, which fuel the transmission of HIV, hepatitis C, sexually transmitted and blood-borne infections, and other harms. As a result, people regularly leave prison in worse condition than when they entered. The gaps are especially pronounced for Indigenous people, racialized people, gender-diverse people, and women, facing the continued impacts of colonialism and limited access to culturally appropriate or gender-appropriate care in prison.
The same structural inequities like poverty, racism, housing instability, and criminalisation of substance use that increase the risk of someone becoming incarcerated also increase their risk of being exposed to those infections in the first place.
People who are incarcerated, they need to have the same access to healthcare and harm reduction services that are in the community. When you immediately cut people off of these drugs, they go through extreme withdrawals and they start to use even more risky and precarious behaviors.
In 2025, the HIV Legal Network published Hard Time Persists, documenting the healthcare and harm reduction policies and practices in Canadian prisons. The report compared policies and practices in Canadian prisons with rights-based approaches recommended by international bodies, such as the World Health Organization. Despite their obligation to provide the same standard of care in prison as in the community, Canadian jurisdictions are failing to meet the standards. This includes not providing universal, voluntary testing, treatment, and counseling for sexually transmitted and blood-borne infections, nor providing low-barrier access to harm reduction, like opioid agonist treatment, naloxone, and sterile needles. Most jurisdictions are prioritizing vague notions of security over concrete, necessary health and harm reduction measures that save lives.
Harm reduction is a public health approach designed to reduce the negative physical and social consequences of drug use without requiring abstinence. Harm reduction is about any kind of progress, any kind of change, right? It's about the little wins. A lot of times people say harm reduction is meeting people where they're at, but not leaving them where they're at.
Meaningful access to healthcare and meaningful access to programming does create necessary change. It is a piece of luggage that people carry forward into their lives outside the incarcerational system. It's the appropriate access to healthcare, appropriate access to social workers, and mental health. It's all these things, it's all the legs of the chair coming together that actually help people not come back.
In Hard Time Persists, the HIV Legal Network outlined promising practices that could meaningfully protect and promote the health of people in prison, and, consequently, public health more broadly. As long as prisons exist in Canada, healthcare and harm reduction must be a priority. The status quo is untenable. Canada must take steps to meet its obligations to the rights of people in prison. The solutions exist. It's a matter of whether governments are willing to act.